This is our weekly check-in to discuss different topics in plastic surgery and answer your questions. Today, we're starting the month of November, also known as Movember. The reason for the Movember is Men's Health Awareness Month. It started about prostate cancer awareness, but it has brought into men's health in all areas. So we are going to be talking about a male-related topic, gynecomastia. This is one of the most common cosmetic procedures a male does. Gynecomastia is having excess breast or skin tissue in the chest of males. And it can be various degrees. So we'll talk a little bit about the different grading systems, the different workup that you need to do, and what are the surgical options to make it seem better, make it better, okay? So gynecomastia, like I said, is excess breast or skin tissue in the chest of males. It can be seen in all age groups, but very commonly in adolescents. When the hormones start to develop, we can see an imbalance of hormones to see growth in the breast tissue of males. In babies, actually, you can see gynecomastia because they can have hormones from the mom circulating still in their bodies when they're newborns, and they can have a little bit of breast tissue. So if you have a newborn and you see a little bit of excess tissue, he doesn't need liposuction. No, he just needs time for the mom hormones to kind of wear off, and it goes away. Then in adolescence, sometimes we see some imbalances in hormones, and it's very common. What do we need to do in adolescence? Wait for them to mature, the hormones to balance out prior to any surgical intervention, okay? And what are the other common reasons? Sometimes that imbalance stays, okay? So we need to check the hormone levels in some males when you have it since adolescence, and it's more glandular. So when you palpate it, it doesn't feel soft like fat, it feels more like breast tissue, like thick. So that can be related to hormone imbalances. So primary care can do some blood work, some levels of different hormones called FSH, LH, testosterone, to check in your blood to make sure that that is in level. The other common reason is medications. There are some medications that actually can cause overgrowth of the breast tissue. Very commonly, some diuretics. So if you have high blood pressure and you recently had started taking some blood pressure medications and you see that you started seeing some growth in the breast, in the chest, in the breast tissue, that might be the reason. So just ask your primary care or the doctor that prescribed those medications to check for that. The other very common reason is actually marijuana use. Marijuana has been linked to growth of the breast tissue in males. So sometimes if you are a common marijuana user, I tell my patients, stop the marijuana and see. Sometimes it regresses and you actually don't need surgery. It goes away. So that is one of the common reasons. And the fourth and more common reason is steroid use, usually associated with working out, sports. You start using some anabolic steroids to enhance that part of the workout, exercise, etc., and that causes some imbalances in the hormones in your body, which may be related to the overgrowth in the chest, okay? So if that's the case, then stop the steroids and you'll see an improvement. But the most common overall is iatrogenic. What does iatrogenic mean? We don't really know, okay? The body really just developed more tissue in you. So we have female patients with large breasts, we have female patients with droopy breasts, and there are some male patients that just grow more breast tissue and more excess skin in that area. The thing is, we have options for you, okay? Like we have options for reducing the breast or increasing the breast size in females. We have options to improve the contour of the chest in males, okay? So what are the options depends on the severity or the grading system for gynecomastia, okay? So there are four grades. It's actually 1, 2A, 2B, and 3. Grade 1 is just a little bit of thick breast excess tissue behind the areola. It usually, it's just like the areola bumps out a little bit. It's not around all the chest. It's just centrally behind the areola. You can feel it because you can palpate, and sometimes you can see it that the areola is kind of poking out a little bit. And the common thing is like, I work out, I'm eating healthy, I lose weight, but I don't lose that. Like, and when I'm wearing a tight shirt or when I'm wearing a bathing suit on the beach, I'm very self-conscious about that. Usually with grade 1, because it's just a little bit of tissue behind the areola, usually we can take care of that with liposuction, even that out with just small incisions hidden in the axilla or in the corner here of the chest. So it's not in the front, and with liposuction, thin that out and contour the chest to be a flatter chest. Grade 2, why it's divided? Because grade 2 means it has more breast tissue. So breast tissue around the chest, not only behind the areola, but all around the chest, okay? And 2A and 2B, it's divided between that 2A doesn't have excess skin, and the 2B has a little bit of excess skin. So you have a little bit of droopiness of the chest skin, okay? Depends on the severity, but usually the grade 2 can be treated with a combination of liposuction to thin the chest all around and contour the chest, and a small periareolar incision. So just a smiley face in the lower part of the areola. Open that up and take, usually behind the areola is where the thick tissue is. That usually doesn't come out with liposuction alone, because that tissue is like fibrous tissue, it's thicker, and it doesn't come out with the cannula of the liposuction. So that's why we need to do that small smiley face hidden in the border of the areola to take that tissue out and get a flat chest, better contour, okay? Grade 3 is the more severe form, which has ptosis. We talk about ptosis with females, there is ptosis with males too, which is basically droopiness of the areola. So the areola complex is below the fold, the IMF, which is the inframammary fold. Once that is pointing down, you have excess skin, you have excess tissue, then just doing liposuction and excision is not going to take, because you're going to have excess skin. So that's when we have the option of excision of the skin. And what do we do with the nipple? So there are 2 options with the nipple. We can do a type of reduction of the chest, similar to what we do with a breast lift. So we need to leave tissue attached to the nipple, so the nipple has blood supply and it survives. Usually with males, I don't like to use that approach, because you say, but why? Because you're keeping the nipple alive. Well, to keep the nipple alive, you have to leave breast tissue behind. And usually for males, it is more important to have a flat chest than to have sensation in the nipple. So that's basically what you need to choose, basically what's more important to you. It's either the contour, you prefer to have a flat chest, and the nipples, I don't care if they're sensitive or not, or for you and for your sexual activity is very important, your nipple sensation, then we have that option. But know that it's not going to be flat, because I need to leave some breast tissue behind, so the nipple has nerves and blood supply and it survives. And the other option is what I mentioned, right? To have it flat, excise everything, and put the nipple as, that's called the free nipple graft. So I take the nipple out, thin it very, very much, and put it basically like a sticker. So I put it back. So it's going to be there, the color will be there, the shape will be there, but it won't have sensation, because it's basically like a sticker on the chest. So the contour is better, the color is there, and the majority of my male patients prefer that option because it gives you a flatter chest, and the importance or the priority of the nipple sensation is not that important to them. But again, if that is, then there is another option, okay? So basically those are the 3 surgeries that we do. Liposuction only if it's only just very little fat, not much breast thick fibrous tissue. Combination of liposuction and periareolar incision, which is a smiley face in the bottom of the areola, if you have a little bit more thick breast tissue behind the areola. And the third, if you have a lot of skin laxity, then it's excision and nipple graft, okay? And for here you have a on this first patient, I did a combination of liposuction and the periocular incision. And as you can see, the periocular incision, it's hidden so well in the areola, you don't really see it. It's very, like, you have to like look very carefully to try to see the areola. But basically, you have a better chest contour, and the pectoralis muscle, it's seen more. So that's very important for males that work out, to have that ability to work out their pecs and have that chest shape that with the gynecomastia, you can't really see it because the gynecomastia is like overshadowing it, okay? And for this patient, you see that there's excess skin and ptosis, which is that the areola is drooping below that fold. So for this patient, if I just go ahead and excise the tissue, it's gonna have saggy, baggy skin. So what I did is an excision of all that tissue, and then you see the nipples, I reduce the size of the areola to make it smaller. Also, I lateralize the areolas. So in breast, in females, the breast area and the areola are more center because the cleavage is important. In males, the areolas are a little bit more lateral. That's part of the chest anatomy in males. So part of the procedure is putting that areolas a little bit more lateral, smaller, and the flat chest, which gives a very good masculine contour of the chest, getting rid of that excess skin and breast tissue. The post-op course, it's very important because by emptying all of that space, we need to do compression. And for my male patients, telling them that they need to wear a faja or a compression garment, it's usually the hardest part for them. But it's only 6 weeks, you can do it, and it's important to have that skin attached to your chest. If you don't do it, then it's basically that skin is you're gonna create a space between your muscle and your skin, and it's always gonna be like floppy. So you want that skin to retract and attach to your chest wall. So when you do work out afterwards, you have more definition of your pec and you can see it better, and your chest contour is gonna be a lot better. So I know you don't like to wear the faja, but the faja is important whenever we do liposuction and whenever we do this type of procedures, to kind of get all that skin to retract and avoid fluid collections, which is one of the things that can happen as seroma. Like we talk with liposuction in other parts of the body, well, it can happen also in the chest. That space can build up with fluid, and if we do, then you can see contour irregularities, so like lumps and bumps. So that's why the compression garment is so important. At first, it's just a wrap, like a binder, okay? And then I'm gonna ask you to wear like a full garment, which is basically like a sleeveless shirt that you can just hide under any clothing. And that you're gonna wear for the first 6 weeks at all times. And then from 6 weeks to 3 months, you're gonna lower it to 12 hours a day, okay? I don't put drains in my gynecomastia cases, so no drains there, just the compression garment. Massages are also helpful if you're doing only liposuction, okay? So if you're a grade 1 that can be taken care of with just liposuction, then I'm gonna ask you to do massages to get all that fluid out and promote the skin tightening, okay? If you had an excisional procedure, then you shouldn't do massages at first because I want those incisions to heal. You could, if you want to, at 2 weeks post-op, okay? So pretty much covered all the grading systems and the surgeries and all of it. So I hope this helped. I hope that talking about male surgeries a little bit more brings a little bit more awareness in men's health. They need to feel that they can have evaluations in cosmetic surgery without the bias and without the looks. And I am all about that. So if you want to have an evaluation, just check my page, go to the link and send us a virtual consultation, and I can let you know which type of procedure is good for you. Okay? I'll see you guys next week in Tuesday Tips.